Do we have any last burning questions? Jane?
My name is Jane Smith. I work for 270 as of yesterday. I, in a previous life, was director of marketing for a large hospital in Minneapolis when HMOs were just beginning, which is a very interesting time. I also worked for a medical reinsurer in Minneapolis for several years, and we developed a national case management program for catastrophic illnesses and injuries. 2 years ago, I was diagnosed and treated for cancer. And even having had that experience, part of my frustration was that when Blue Cross authorized benefits for me to go to the hospital, they never said me anything about, you know, Jane, these might be questions you want to ask.
Right.
When the provider admitted me, they didn't give me or my husband any list of questions about, you might want to ask these questions, either, you know, to the surgeon when he comes to talk to you, or after, you know, after you've had surgery. You know, there's still an amazing gap. Financing is part of it. You talk about utilization review. There's so little still that's done in terms of helping those of us that are patients be active selectors of care and advocates for our own care. And that it was amazing to experience that up close and personally. And my hope is that through this discussion, you all are going to realize that there are a lot of places where you touch patients early on, and you must do a much better job of helping us be sophisticated purchasers of services. The place where I had surgery is sending me a bill that is more than what Blue Cross will pay. And that's the provider's problem. That's not Blue Cross's problem, but I need to now bring over my Blue Cross certification information, authorization information for the hospital to understand that your bill is fine, but I don't have to pay it. So there's still a lot of miscommunication, and even for those of us that consider ourselves to be reasonably well educated, it was just abysmal to me. I mean, as a breast cancer survivor, and I'm among a lot of women and some men, there's still so much that you can do in terms of patient education and communications in a proactive way. I don't need a case manager calling me 6 months after surgery. I want somebody to talk with me early on and help me understand what are my choices. What if I say no? I can say no. You know?
Okay, let them talk.
Yeah, so you know,
Thank you.
in the end, we spent most of the morning, although a little bit unconventional, most of the morning talking about the financing piece, right? Insurance,
Sure.
exchanges, and taxes and all that. But in the end, it's really about healthcare provision, coordination, you know, how you get the care, how the system's integrated or not. And the crux of the whole thing is if we create a better healthcare system and this bill helps us do that, then it's going to be successful. You know, if it doesn't, if we don't deal with some of the issues you're talking about, it really won't, because it's really about healthcare in the end, not about, you know, the financing piece, which is the way it pays.
Is it safe to assume that everybody at this table does believe in their heart of hearts, that you can't prove it yet, but you do believe that this health care bill will in fact improve our situation? Does everybody feel that way?
No.
Oh, okay. Just checking.
I think, first of all, congratulations on the new position, and good luck with, sounds like things are going well.
Very lucky.
I think one of the, and I agree with Ken's point, we talked a lot about financing, but not really about health or actually wellness, to one of the HR issues raised earlier. But one of the perhaps explicit, if not implicit, goals of health, of the plan is to move more people towards preventative care, early intervention. And currently, you know, the system is working just as the system's been designed to work. What do we get paid for? We get paid for doing things. We get paid for treating illness. We don't get paid for preventing illness. Hence, you know, is there reimbursement currently? You know, this is a capitalistic society and a business. Is there reimbursement for talking to people for a long time about their options when they have breast cancer? Absolutely not. There is no reimbursement for that, so who will do that? It's a simple economical issue. I think with a higher stress on prevention, there has to be venues where physicians, nurses, nurse practitioners have the time and can spend the at least 30 minutes to talk to a new, I mean, this is a very difficult situation that somebody has just been notified that they have breast cancer. It's not a 5-minute office visit. This is a, you know, a 30, 40-minute talk, but the current system just doesn't support that. So with a push towards more primary care, more early intervention, we hope that the payment system is reformed that supports these kind of discussions, and also these very important list of options that have to be given to patients, as well as education. Are there ways to prevent breast cancer? Is there is there nutritional support for that? Is there mental health support for that? And I think one more thing I'd like to add to that is, we didn't talk about this at all, but it's very important, is the health information technology exchanges. Is that information from your primary care's office to your hospital to your surgeon, is that or are you answering the same question every single time you enter the system that you've answered 20 times before, which is not only frustrating but leads to errors? And one of the part of the healthcare reform, but more so part of the stimulus package, is a significant push for embracing health information technology for not only hospitals but for physician offices, in which patients also play a major role. We are in the process of launching electronic medical records for our physicians, and a major component of that is a web portal for patients as well. So for very simple things like setting up an office visit, you can enter through a website and put in office times, and I don't know, I think Kaiser already has that. Thanks. But more importantly, over time, that's just the beginning. That's a very basic functionality. Over time, if you're a diabetic, are there educational pieces? Are there reminders? Are there resources that you can approach? If you have breast cancer, is there advice? Is there that you can really use? And over time, I think the technology playing field will level out. Right now, it's all stacked on our side, meaning the physicians, the hospitals have a lot of information and the patients don't. But I think the beauty of technology is that it helps level that playing field so that everybody, at least those with access to the internet and some savvy with technology, can get access to a lot more information. And we're seeing that already, but I really think in the next 10 years that's going to explode so that we can be much more responsible for our own well-being and care and go into the doctor's office or the hospital with, you know what, this is what I think I need. Tell me what you think. So we hope that this is one of the outcomes of this package as well as the stimulus
Okay,
package.
so really of the six of you, nobody's going to raise their hand and say, I think this is better? You do think it's better?
I think it's.
I'm cautiously optimistic. I mean,
Oh, okay,
we've talked-
I'm good with cautiously optimistic. Are you cautiously?
We've talked about a lot of ups and downs, and we'll see kind of questions, which I think are all out there.
But cautious optimism is better than, this is lame.
I mean, what we have to come to grips is we have really right now a lot of people that don't have health insurance. So many of us in this room, I assume because we're in this room, tend to be employed rather than
Yeah.
not. So maybe that's a little less of a worry, but there's an awful lot of people who have been falling through the cracks.
What
And
do you
this
think?
bill does address that.
I'm curious, what do you think?
Healthcare reform is a misnomer. It's really health plan reform. What the law, at least in my reading, does is reform the way that employer-sponsored healthcare is administered, designed, communicated, and priced. And eventually, in 2014, is going to lead to the creation of the insurance exchanges where the uninsured, the 32 million that they talk about, are going to be able to go in and buy coverage. Is that a good thing? Yes, it is good that people will be able to buy coverage. What is it going to do to the cost of health care? That's a question that we've all talked about and kind of shaken our heads about today. The other comment is we spent a lot of time talking about preventive care. Right now, there are 1.25 primary care physicians for every 1,000 Americans. So if we open up the floodgates for having preventive care covered without cost sharing, we're going to have a lot of people going to the doctor and having a lot of work done for the first time. What is that going to do to wait time, quality of care, and other issues that need to be addressed? So
Wow.
what I like to say is the road to health reform is narrow and not all of the curves are clearly marked.
Fantastic note to end on. You guys, I want to thank you so much for your time, for your energy, for your expertise. And also, of course, the audience, thank you so much for your participation. This has been, I learned a lot. I hope you guys did as well.